All right, let's talk about this. Do you know the #1 killer of men and women worldwide? It's not cancer, it's not car accidents, it's actually heart disease.
Heart Health Month is February, but with the statistics that come with heart disease, it's an important conversation any time of year. Dr. Stephen Bradley is a cardiologist with Allina Health. Thank you so much for coming in today.
Thanks for having me. Pleasure to be here.
Before we get into all the tips and advice you can give us, people maybe hear about it a lot, but what is cardiovascular disease? Why is it so deadly?
Yeah, that's a great question. And part of it is it's important to understand how common cardiovascular disease is. It turns out nearly half of all of Americans have some form of cardiovascular disease. And when we say that, I'm not just talking about heart attack and strokes, but other conditions like high blood pressure, elevated cholesterol that can lead to plaque deposition in the blood vessels that sets people up for those conditions later on in life.
Who is at risk for heart attacks and what are the warning signs?
So that comes back to those other conditions. So when we think about pre-existing conditions like hypertension or high cholesterol, that increases the risk for problems down the line. And so people who have those risk factors of those conditions need to pay particular attention because they are at that increased risk. And when we think about signs or symptoms of heart attack, the most common is chest pressure or discomfort. We oftentimes ask about chest pain, but most patients describe a discomfort or pressure sensation, oftentimes associated with things like shortness of breath or lightheadedness or sweating. Nausea or vomiting can also be a symptom. There's also this conception that women have different symptoms, and that's true, that proportionally they can have different symptoms, but the most common symptom for women is still chest pressure, discomfort, and shortness of breath.
And you were telling us a second ago, it's not just people in middle or later age, and we're not saying that young people need to be worried all of a sudden, but it's not impossible for them to have a heart problem at a young age.
Absolutely, and that's particularly true for people who have family members who have had a heart attack in early age, so parents or grandparents or siblings even who have had heart issues, that should be a sign to them that they may carry some of those same genetic risks.
And to know like your numbers, like you were talking about, and your markers of health. What can people do to reduce the risk of heart disease?
Yeah, the changes really are relatively simple, and first to focus on those modifiable factors. So as we get older, we're at increased risk, but so far we can't modify how old we are, so it's important to focus on things like cholesterol and blood pressure, and simple changes like paying attention to your diet, so emphasizing healthy foods, fruits, vegetables, whole grain. Exercise, we want to shoot for a goal of 150 minutes a week of moderate to vigorous activity, and then avoiding tobacco. Those are key components. Also, addressing risk, getting good sleep are the foundational components.
You mentioned the diet in particular. Some people might think, oh, I'm just eating healthy because I maybe be limiting calories, but what to you truly means healthy eating for the heart?
That's a great question, and I'll often ask my patients about their diet, and they instantly get into this concept of, I'm supposed to be restricting. It's less about the restriction and more about what's the content, what type of foods are you eating. So avoiding those processed foods, I talk about don't eat things that you can get at a gas station or a fast food restaurant. Focus on those fresh foods, so fruits, vegetables, whole grain is really foundational. And we don't have any problem with fats. Fats are actually an important and healthy part of your diet if they're the right types of fats. So things like olive oil, avocado, fish that's not fried, all important sources.
Okay, and then finally we want to say, if someone is nervous about their heart health, but they haven't been to a doctor in a while, where would you suggest starting?
I think an important conversation to start having with your primary care provider. Certainly, cardiologists are always available to you, and we're happy to have those conversations with individuals, but starting with that primary care provider to understand what is my risk, how does that factor in terms of my family history, my cholesterol, my blood pressure, and how do I go about addressing that?
Okay, well, we appreciate it. Thank you so much for helping us navigate it. Really helpful stuff.